It's estimated that around 1 billion drug prescriptions are filled out every year. 80% of these use a single-use plastic cartridge called a blister pack. What's more, a whopping 50% of these prescriptions don't get used correctly. This has severe ecological impacts, with pharmaceutical waste ending up in our streams, putting us directly at risk, especially our aging population, who are more likely to suffer from Alzheimer's or mental illness. In fact, it's estimated that up to 75% of people over 60 forget to take their medication on a regular basis. This accounts for 1 in every 10 hospital admissions, and costs around $290 billion every year. So what can we do to fix this? Introducing HeadsUp, a smart, friendly drug prescription service aimed towards encouraging elderly patients to comply with their prescriptions and in turn reduce the impacts of the pharmaceutical industry. To find out how this all works, let's meet Frank. Frank hasn't been feeling too well lately and heads over to his doctor for a checkup. He's just been diagnosed with early onset dementia and joins the 1 in every 10 people that suffers from Alzheimer's. His doctor refers him to the HeadsUp service, which will help him keep track of his prescriptions and allow Frank a little more independence. Frank signs up through his local chemist, who take his details and emergency contact numbers. The pharmacist then fills up a special reusable blister pack for Frank and seals it with a card cover. This card has a conductive layer and works with the blister pack to create some clever circuitry. The pharmacist then pairs his blister pack with a smart wristband. The wristband will gently let Frank know when to take his medication, and even give him helpful reminders about the day and the time. A small light will also turn on next to the medicine Frank needs to take. Once Frank opens that seal, the circuit within the card breaks, and the HeadsUp system knows Frank has taken his medication. Part of the HeadsUp service Frank signed up for includes proactive monitoring, which means that his blister pack and wristband will talk back to the pharmacy and let them know if Frank forgot to take his medication. They can then follow up with a phone call or ask one of Frank's neighbours to pay him a visit, just to make sure he's okay. When Frank comes back to the chemist to refill his prescription, the chemist swaps over his wristband and blister pack with a newly charged set. The old ones will get recharged, sterilised, and sent off with a new patient. Frank's pack gets refilled and sealed with a new card. Frank can now go back home with a new set of medicines, and anything Frank forgot to take can be destroyed properly, so that they don't end up in our waste streams. All of the used cards can get recycled properly, with any conductive materials getting extracted and reused. In this way, Frank sees a better quality of care, there's a reduced burden on hospitals and nursing homes, waterways see a decrease in medical contaminants, and the ecosystem sees less waste, less plastic, and less resources used, which is better for all of us.